unfortunately, the only mic that's working is this one. Okay. But we can.
We're live right now.
But this is hybrid, right?
Yeah. Yeah.
So anything else that people are at home out of it?
It's not. You make it hard. Why everybody sitting in the back?
Because Rosa Parks made it possible for us. We said it back, we said, what, because we have to.
I can tell you right now, Bill and I could have not sat next to each other in school because I would have been suspended.
Thank you.
I was honestly hoping that this was going to be a peanut butter and jelly sandwich.
The Anacostia Community Museum had an event with kids this morning, and they called me up and said, would you like to have the rest of the lunch? I said, why not? For the, I mean, it's so food. I mean, I've had happy meals at McDonald's.
I was vegetarian and I went to the army, and I tried my best to not eat meat for like my first few weeks in basic training. I ate all the peanut butter I could eat for like 2 years. They bought me out.
Okay.
Councilmember Henderson, we're also live streaming this on the ATC.
Okay.
Right. Okay.
Great. Good evening, everyone. Welcome to Community Room at TheArc. We are here. I'm Lamont Mitchell, Chairman of the Board of ACC, and we're here for another conversation with the at-large Councilwoman Christina Henderson. A couple things. She is an amazing young woman that so happened to be born the day I was born in October, but a lot of years different. So a lot of years different, but yeah, but more so, she is one of the youngest members of the council. You know, our council can be a little bit mature, and we're happy to have some young voices on the council. And she is extremely effective councilwoman, and we honor and like the fact that she come here. And before we bring her up, I just want to talk about one thing that's dear to our heart at ACC. June is Men's Health Month. And, you know, we have a project we call Know Your Numbers DC, which encourages African-American men to get tested for morbidities, the diseases that affects us the most, lifestyle diseases, prostate cancer, diabetes, heart disease, and we will announce a nice campaign this month where we will take to social media and when Stuart and all the other candidates get their signs up off the sidewalk, we'll put down some of our signs, but we don't want to mix them up with the politics. So as soon as y'all finish, we'll put this Know Your Number signs up. But Councilwoman Henderson is the chair of the Health Committee. It's near and dear to her heart, and we really need to look at some things that relates to health, particularly east of the river and African-American men. We used to have a committee on men's health or a commission on men's health, and we don't have that anymore, but it's so important because in order to have strong families, you must first have strong fathers. And to have strong fathers, you have to have healthy fathers. And at ACC, this is a collaboration of ACC and Martha's Table, Ward 8 Health Council, Health Alliance. We want to bring about and we want to advocate, as you know, Ambrose Lane, we work with him, he's advocating for a men's commission on health. And we want to emphasize that it's so vitally important, particularly for Black men east of the river. Now, I'm not going to take up the time. I'm going to introduce her. She's going to come in her way. We'll talk about some budget issues and we'll talk about some things. But one thing I like about her, she's a fighter and she's not afraid to take on the difficult issues, and she's an amazing young politician, and we welcome her here east of the river.
Thanks so much. Thank you to the ACC for co-sponsoring this event. And thank you all for attending. I know that first off it's hot outside, so there's that, but also there's a lot of things that are going on in the district right now. And so it is never lost on me when people take the additional time after the workday to come out to something or to tune into something. So hello to the folks who may be watching online. So I want to just jump right in. If you didn't get a copy of the slides, raise your hand. We can certainly get one for you. We did a budget conversation similar to this in Ward 5. I've actually done a couple sort of in the Ward 5 area. And before we get into sort of talking about the nitty gritty of the budget, I always like to level set and not assume that everybody knows sort of the basic 101s about the budget. So let's get started. Because I wanna make sure we all operating off the same set of facts. So we're gonna go to the next slide. Okay, so in terms of the very basics, there are 3 types of spending that we have in our budget. Personnel, so that's salary and benefits. Non-personnel spending, that could be everything associated with something that is not an employee. So supplies, subsidies like Medicaid, TANF, SNAP, contracts for various services, that is all included in non-personnel services. And then the third bucket is capital. So capital is associated with anything to build or maintain a particular building. What is important to know is that while personnel and non-personnel spending can sort of go back and forth between the 2 buckets, capital funding doesn't really work that way. So when we're having conversations about this budget in particular, I've heard a lot of people who are saying, well, you guys are spending all this money on a stadium, but you're not spending it on people. Capital money is different. It doesn't sort of flow back and forth in the same way as non-personnel and personnel funding. And I think that's important for us to know. So where does our money come from? Now, this became a point of contention earlier this year, but because if you talk to some members of Congress, they would have you thinking that the vast majority of our funding in the District of Columbia is coming from the federal government, and it is not. 54%, actually 55% of our funding is actually local dollars. Local. That's our money. We raised it, and we should be able to control how we spend it. Now, federal is not a small or insignificant piece. About 26% of the funding for our budget is federal. A lot of that, again, Medicaid, TANF, SNAP, federal highway funds that we use around transportation and other things. And then we have a variety of things, dedicated taxes, private grants and donations. So that would be if we got a foundation gave us a grant for a particular activity. That is basically the makeup of our budget. Can you go to the next slide? Now let's break down local funding, which I think is super important because sometimes we have folks who will say, well, we just need to raise revenue. Then I think we need to ask ourselves, what does that exactly mean? The largest portion of where we get our funding in terms of local revenue is from income tax. What is different between the District of Columbia and other jurisdictions is that DC, and our sort of special snowflake federal district, not quite a state manner, is that we are a jurisdiction that is not allowed to tax the income of individuals who don't live here, even if they work here. That is not the case in other places. So when we're talking about income tax, that's us. That's the people who are living here, okay? So when folks are like, well, we're just gonna raise income taxes, that's us, the people who are living here. Okay, property tax. Property tax is the second largest bucket. Property tax includes both residential, where you live, as well as commercial properties. So commercial properties downtown, Walgreens, or where a supermarket may be, or something to that effect, that is where the commercial property is. And then sales tax, of course, is sales tax on goods and services. Sales tax is probably the biggest area where we're gaining revenue from other people who don't live here. Right, so tourists, right, come on, spend with us in the nation's capital, but come stay in our hotels, go to our restaurants, go to concerts, etc. But there's also sales tax on other types of goods and services as well that we as residents would purchase. But that is the bulk of where our local funding is coming from. Next slide. Okay, so in terms of the FY26 budget and how it is broken down, where are we spending the vast majority of our money, or where's the mayor proposing that we spend the vast majority of the money? The biggest section is public education. It should be no surprise to anyone. Public education has been sort of the largest area of where we have spent money for a little bit of time here. The next biggest section is human services. So human services is actually everything, and that includes human services that you would get from the Department of Human Services, but it also includes health is in there as well. The next biggest bucket is public safety at 13%. And then you can kind of see the other places where funding is. We're talking about $13 billion across the budget proposed for FY26, and for including all of the various sources. You can go to the next slide. So capital budget, where do we spend our capital money? And I remember I said at the beginning, right, capital is different than operating. The biggest bucket, no surprise, DDOT. That's roads, that's sidewalks, that's trails, that's street lights. DDOT actually does quite a bit that most people don't know falls into their bucket, into their category, but it does. The next biggest bucket is DCPS. That would be not a surprise for you all. When I was coming down Mississippi Avenue, we got a new school that's going up. That costs money, lots of money. And then our next biggest chunk is WMATA. And so that is our payment that we make to WMATA. And as you guys know, WMATA costs are shared across the 3 jurisdictions. And of lately, they've been doing very well. Okay, I want to, here we go. All right. So I chair the health committee, as was sort of said. So I want to break down some of the proposed changes in the health committee budget, because I really think it's super important for people to understand. It is going to impact a lot of people, and so we need to kind of talk about it. All right, so let's level set first. When we're talking about the Medicaid program, there are federal requirements in terms of what the federal government requires states to cover in terms of people, and then there's the extra stuff where states choose to go beyond that. The dark blue here and the dark green here are technically the only things that the federal government requires us to cover. So up to 29% of the federal poverty line for parents and caretakers, and children under 19 up to 138% of the federal poverty line. The federal government does not require us to cover childless adults at all. Now, we could debate that, but I'm not a member of Congress, so we'll save that for a different day. The district has significantly expanded its eligibility across all categories because it was very important for us for people to be covered. So we cover childless adults up to 215% of the federal poverty line. For those who might be wondering what that looks like, if you go to the next slide, we break it down for you. So how much money are we talking about? So like in DC, if you are in a household of 4, we are covering you under Medicaid, you're eligible for Medicaid, up to $71,000 in terms of your income, which is incredibly generous because look what they're doing in Maryland. In Maryland, it's $44,000. In Virginia, it's also $44,000, right? So when people talk about the coverage pieces, it's very significant here. In terms of childless adults, 138%, we go up to 215. So we have been able to cover up to 97% of our residents with healthcare of some type because of our very, I would say, bold eligibility. If we go to the next slide. What the mayor is proposing is that we shift individuals, adults, who are currently in the 133% of the poverty line to up to 200% to what is known as, and I don't like the name, but roll with me, it's called the Basic Health Plan on the Health Benefit Exchange. So that impacts about 25,000 people here in the district. And what it essentially would be is that you will no longer have Medicaid, you will be on the exchange, but due to your income, you still qualify for subsidies and credits. So therefore, we believe that even moving this group, they would have minimal premiums and have no cost sharing in terms of their health care. We go to the next slide. Okay, so what is the differences in terms of what is covered? Primary care, it's on Medicaid. It would also be under the basic health plan. It's essentially everything that we have on the essential health benefits. Hospital services, including x-rays, diagnostics, all of that, both Medicaid benefit as well as a BHP benefit. Mental and behavioral health, prescription drugs, rehabilitation services, all included. So you might be asking, okay, that sounds all nice and good, but what's not there? Unfortunately, the federal government has decided that dental and vision do not count as an essential health benefit. So that is a big thing because folks are able to have access to vision and dental on Medicaid. I personally think, obviously, your eyeballs and your teeth are part of your body. It should be part of your full health care. So here's what we are trying to do. We have asked the Health Benefit Exchange Authority, how much would it cost if we wanted to add the dental benefit and pay for it for individuals who are being moved to the BHP? Right now, it's about $17 per member per month, which rounds out to about $5 million. In order to be able to do that, we are trying to pursue that effort. Unfortunately, federal law does not allow the exchange to offer vision coverage at all. So we wouldn't even be able to basically pay for an add-on for vision if we wanted to. So I think this is super important. I want to explain this to people because I feel like they need to understand what's happening here. If you go to the next slide. Now, if we kept the status quo, right? If we did nothing, if we let everybody stay on who is eligible currently, if we didn't move to the basic health plan, how much would it cost the district?
I have it on my screen.
There we go. So it would be an additional $52.5 million that we would have to find to be able to make absolutely no changes whatsoever. I'm gonna stop here to see if folks have questions about this part before, because I don't think I've done this presentation now. Yeah, okay, let's stop here. Because the next slides talk about the Alliance program, which is a little bit different. Does anybody have any questions of just like clarity pieces? Yes?
So for clarity, I think I read or heard somewhere on Twitter, 25,000 people would be without healthcare.
No, 25,000 people will be transitioned
Okay.
from Medicaid to a basic health plan. We have talked to the Health Benefit Exchange as well as Department of Healthcare Finance of what this looks like, right? Do people have to sign up? Do they have to go through an application process all again? No. The way we would design it is to run the eligibility at the end of December. And essentially, anyone who falls into this eligibility category, your data would essentially be transferred right over to healthcare finance, and you will be automatically enrolled. All of the MCOs on Medicaid, so if you have AmeriGroup, AmeriHealth, or MedStar, would be participating on the basic health plan. So if you like where you're at, it won't look different from an interface for you because you'll still have that relationship with your current medical MCO. They are inviting Care First, Blue Cross Blue Shield, as well as Kaiser to participate. So at some point, if someone says, you know what, AmeriHealth is really not doing it for me, I'm going to switch to Care First, you would have the option to switch your health plan. But we want to make sure that the transition is as seamless as possible for folks, as opposed to saying, we need now 25,000 people to submit documents and information to sign up for healthcare all over again.
And is that just for this fiscal year, or is that, as far as we can see right now, permanent?
That would be for the transition, and then going forward, it would be like during regular open enrollment. You know how when they were like open enrollment at the end, I think it's like starts in October and it goes until December, then that would be normal for everybody else. And how open enrollment works now, well, you know, for those of you who have private insurance or otherwise, but if you're good, you just keep going. You don't actually have to do anything unless you want to make changes to your plan or to your coverage.
Thank
Yeah. Yes, ma'am, in the back.
And so when switching from the Medicaid plans that we have now to the basic health plans, is that what you were stating, that does not cover vision and dental?
Yes, ma'am.
I received that, so that will be back out for the basic health plan.
I am trying to find every possible option on the vision part. But the feds basically barring health exchanges across the country from offering vision as a separate plan or benefit is really a barrier and a challenge. We have a really good relationship with a company, it's called VSP, that does provide vision insurance. That they have like a link on their website that you're able to go to. And at least from what I've seen, like the prices it's like I forget how much it is, but it's for like the entire year and then you have it covered. But the vision piece I knew was always gonna be the, vision and dental was gonna be the,
So if you don't, so basically, is this gonna be a mandatory switch that's gonna have to happen, or could you stick with your current health plan if you want?
you would not be able to stay in Medicaid.
Okay.
Yeah.
So I would still be able to be under AmeriHealth, but I would not be under a Medicaid plan.
Correct.
I would basically be paying out of pocket time.
Not necessarily. So here's the thing. While we are doing this in terms of our budget, there's also stuff that's going on the federal side around changes that they want to make to Medicaid and otherwise. The House bill that they passed on reconciliation introduces cost sharing into the Medicaid program where there has been none before. And so what we're trying to do is to make sure that we're not devising two plans that that doesn't have full parity, if that makes sense. So like if Medicaid is gonna be required to have cost sharing, we can't have a basic health plan where you don't have to pay anything. Because then I would have a bunch of people who are like, well, then why am I on Medicaid if I could just go over here and get it for free? So we kind of have to figure those pieces out as we go through the process. One thing I didn't mention is that even though we're doing this in the budget process, the transition would not occur in October.
Okay.
It would occur in January of 2026. Okay, yes.
Question. We talked about this two-part question. One, this only affects single people who are children. Child.
Sword. If we go back. Okay, so, yes, what we are talking about is trying to keep as many children as possible on Medicaid. And so really, it's the childless adult piece, but it could also be a relative or caretaker of a child.
Right, but the children will be covered. You got some child, but a single man like me, this cuts will affect. Okay, two questions.
Yeah.
1 to 52 million.
Yeah.
52 million out of 20 billion. It's not a lot of money. It's not a lot of money overall. Now, if trying to be specific, it might be, but in terms of overall percentage of the budget, it's not a lot of money. And number two, what about the seniors who are on Medicare, but also on Medicaid, who, because of the low income, will they be kicked off of the Medicare, and will they go to this plan? Because one of the biggest things with these plans, because even if you had a general coverage, you talked about getting this outside general coverage for the Medicare. One of the biggest ripoff going period ever in life is optical care. Because they said, oh, you got $500 to buy you some glasses with, and you pay $200 for them. You could go and buy the same glasses for $150 somewhere and forget about the insurance. But the insurance is going to make you pay $600 for your glasses.
Mm-hmm.
So, even if you have a plan for work, the optical plan really, not unless you got some problems with your eyes or some surgery, something, just to buy glasses or contacts is very, very expensive. You can buy them on the open market for less. So you get these plans, they really don't amount to a lot. You follow me? And so what happens to the senior, I'm a senior, what happens to me if I was on Medicaid, Medicaid, and I was getting those services free and getting my co-pays free.
Yep.
And paying my Medicare deductible Medicare care deductible on by my Medicaid.
Mhm.
What happens to that?
Yep, so first off, from an income perspective, most seniors who fall in this category would there would be no change for them because their income is not such where they're making a lot of money, if that makes sense.
That's something.
Some do, but
Because to change the ratio.
Most don't.
21 down to here, it could be a person that could make, 35,000 or 40,000, and then it will take it down to 30,000.
yeah, but the other biggest difference too is the interaction between Medicare and Medicaid. When you transition and you're on Medicare, Medicaid is like, they kind of sort of treat it like a last dollar.
Yes.
Right, so we need to sort of unpack that more. I'll be honest with you.
Medicaid will pay for all of your co-pays. It'll pay for your 20% for your Medicaid, the co-pay for that. It'll pay for your medication, and we're talking about seniors.
Yes.
Medication, cancer drugs will get very, very expensive.
Yep.
For senior, and it might be just a small bubble like we talked about, but that
Yeah.
bubble could be massive and devastating for seniors.
Yeah, and these are some of the questions that we're asking healthcare finance before we go forward with this in terms of, let's drill down. How many people are we talking about? But also, let's talk about some other things. How much, I know I love our budget analysts and in the CFO's office, but we set a lot of questions of like a breakdown of, tell me how much it would cost if I want to put X population back. Tell me how much it would cost if I want to add dental. Tell me how much it would cost if I want to do durable medical equipment. Tell me how much. So we're trying to figure out what the price list is and see as a council, what are the things that we can put back together so that the basic health plan, and again, I hate that title and we're going to change it, but so that it could be as robust as possible for folks. Because I don't want people to feel like they've lost something in terms of coverage, right? Especially when we're talking about some of these super important things. Yes, ma'am.
So we know about the 25,000, but we've had conversations that there's an additional 27,000 people who are going to lose coverage. And what about the work requirement? In the mayor's budget proposal, she talks about limiting enrollment in this.
Oh yeah, we're gonna get to the alliance. that's what you're referring to. Does anybody have any other questions about Medicaid first? Yes.
I'm trying to understand the math and hoping to shed some light. So I get that the cost of keeping the Medicaid eligibility as it is over 52 million.
Additional
Right.
to what we already pay.
Exactly.
Yep.
And so then for like the basic healthcare, which we don't like that name, but that's what we're calling it. If we added dental, that would be 5 million. I assume vision, even though it's not possible, like if it was, would be in a similar ballpark. And I'm hearing consistently that other than that, there's not much change in care. And so I'm trying to understand kind of how the cost is in then the tens of millions and what else people are missing.
Yep, so here's the thing. So for Medicaid, we have an MCO program, which means we pay per member per month, regardless of if you ever use a service. We're paying over $8,000 a month for folks to have Medicaid, right? So what we asked healthcare finance to do is like pull for me data of how many people who have not had a claim in 12 months, how many who have not had a claim in 24 months, and how many people who have not had a claim in 36 months. Now, if you haven't had a single claim in 36 months, that means either you are extremely healthy, right? No urgent care, no prescription, no doctor visit, you didn't go to the dentist, you didn't do anything, or you're not here. And we've been paying for you, which is completely possible, right? In terms of that part. By switching over to the exchange, we're no longer paying the per member per month. We are essentially paying as you use the service, or not we, but you know what I mean? Like it's more of a fee for service model as opposed to the MCO model.
Does that mean, thank you, does that mean that folks will be expected to cover more of a cost up front and be reimbursed?
No, so as I said before, the way that we are devising it in terms of, we're having conversations with our actuarials right now, the hope is that there will be no premiums,
Right.
but there might be minimal cost sharing, which we anticipate would also be on the Medicaid side if the federal changes go into effect as well.
Thank you.
Yeah, no problem. All right, so let's talk Alliance, which is a little bit different. Is everybody familiar with Alliance, or should I say what it is? Okay, so Alliance is a health program that we have here in the district for individuals who do not qualify for federal Medicaid or Medicare. There could be a variety of reasons as to why that is, but in some cases, it is about your citizenship status. Okay, we're good. All right, so what has been a change in terms of Alliance in the last 2 years? So in 2023, there were about 18,500 individuals enrolled in Alliance. We were paying about $138 million, all local. So there is no federal match in terms of the Alliance program. So that's only coming from us. And so that was about $7,400 per person that we were paying. In 2 years, the enrollment grew to 28,391, and the cost has risen to $181 million. So that's a significant increase in the program in a very short period of time, and there is no federal match for this. So we are paying 100% of the costs from our local dollars. All right, we'll go to the next slide.
The council member, the
Yes.
money that you spend per person decreased.
What's that?
The money per person went down.
Yes,
So why you
it's an average. It's an average. So it went up 50, 40, my math, nonetheless, yes. We also have less people, even though you're enrolled, we have less people actually using it than we did back then as well, which is a little bit interesting. If you go to the next slide. Okay, so given the cost projections of where the program was going, if we made no changes whatsoever, and we kept the status quo, I don't know why she put
Animation.
an animation on here. Let me just look at the slide.
There we go.
Okay, so if we made no changes, it would cost about $248 million for us to operate Alliance in FY26. Keep going. So the change, now, this is according to Healthcare Finance, not my numbers. According to the Department of Healthcare Finance, the changes that they want to propose would generate about $127 million in savings in FY '26, and then $769.8 million over the financial plan. Now, again, I have to acknowledge that we are having this conversation in the context of what is happening in the Congress right now. What additional that is not on here is that the House included a provision in their House reconciliation bill that essentially is a penalty. It says that any state that is using their local dollars to fund health insurance programs for undocumented individuals will face a penalty on their Medicaid. That penalty for the district would probably be about an additional $100 million. They haven't passed that yet, but that is something that is sort of in the forefront in terms of what is being thought about. If we go to the next slide. Okay. If you have the slides in front of you, it's probably easier to read it because it's fun, it's small. But these are the proposed changes that are included in the Budget Support Act that the mayor introduced. So first, starting August 1st, 2021, they want to freeze the enrollment for Alliance. So that means if you're not in it now, you can't join it after that date for adults that are 21 and over. So that would be at about 28,000 individuals. This freeze would not count for children if you're under 21. Okay, then starting October 1, instead of managed care, they would move to fee for service, since we sort of talked about that. So instead of paying per member per month for someone who may not be using the service, we would only be paying as you use your health care. Also, starting October 1, they would reduce the income eligibility, similar to reducing the income eligibility that is being proposed on the Medicaid side. So it would go from 200% of FPL to down to 138. Well, 133, but we have a 5% grace. So 138 in terms of FPL. If you remember, that takes it down to about an income of $40,000-ish or so for a family of 4. Also, starting October 1, they want to limit the benefits in terms of what Alliance members can cover to essentially primary care, hospital, ED usage, prescription drugs. Under 21 will have access to services in behavioral health. We'll also be making a shift for children. Right now, we have this program called the Immigrant Children's Program. It's not a great name for our political environment right now, so we're going to shift that. And then starting next year in March, they want to reintroduce a 6-month recertification process. Right now, when you are in sync for Medicaid and Alliance, it's an annual renewal. So we are annually checking to see whether or not you are continuously eligible. The big controversy here, and we're trying to figure out with Healthcare Finance, is it necessary, is that for Medicaid, when you are renewing, you do it online. Log into the portal, upload your documents, and keep it moving. Healthcare Finance wants to reintroduce a face-to-face recertification, meaning that somebody would actually have to go to one of the service centers, present your documents, and do all of the different things. And then starting October 1 of 2027, Alliance would only be for children. We would no longer cover adults over 21. So these are the changes that the mayor is proposing for the Alliance program.
Question,
Yes, sir.
what do we do with the $100 million penalty?
What do you mean?
Do we pay the penalty?
So the mayor developed this budget outside of that penalty. We will deal with the penalty should it come in terms of what changes we might need to make or not.
Okay, follow-up question. How do we know what a undocumented person makes?
They have pay stubs.
Well, what about, but a lot of undocumented workers, they work under the table.
Work under the table.
Yes.
Work under the table, so they're not gonna say what they make. Particularly now, you're not gonna pay a pay stub, they know where to come get you. You probably should, that's something you have to look at. So I was trying to figure out, you said, we're gonna check their eligibility based on what they make.
Yeah, right now we check based on, there is a income threshold. And again, as a reminder, right, the Alliance is not just for individuals who don't have documentation. There are people who are who have green cards or otherwise, but they don't qualify for Medicaid, they don't qualify for Medicare, who are also on this program. Like DACA recipients would be sort of in that realm as well. Yes, ma'am.
I have two questions, and the first is just a curiosity. Our council members obviously are leaders here in the local landscape, and I think there's a lot of leadership required in this moment when we think about how we're keeping undocumented folks safe. And I'm very curious, especially on the health committee side, what conversations around that 6-month recertification look like when we know all around the country folks are being targeted at appointments where they are asked to show up for things like this.
Yes.
I think like 25,000 people are already being removed from healthcare.
Transition.
What consideration is being made about folks who will almost opt out because they cannot take the risk of showing up?
Yeah, so I would say amongst Committee on Health members, the face-to-face recertification is our biggest issue in terms of immediate piece. Because again, if I could do it online right now, why do you need to see my face if I could just upload the documents that are being requested of me? And we know that the last time we required face-to-face recertification, lots of people fell off the rolls. So that's one of the ones that we are really pushing on. You said you had 2 questions though.
Yeah, and thank you so much for that answer. It's really good to know that y'all are considering that. I've heard the cost of how much it would cost to not make these changes. I'm curious if there's been any sort of fiscal impact analysis on the cost of removing this many people from healthcare plans in terms of revenue that they would otherwise be generating, in terms of that healthcare is often a driving cost for bankruptcy, for eviction, etc. And if there's any analysis that's been done on the long-term fiscal impact there.
Not that I am aware of. But in some of this, we're having these conversations, right? So one of the things that they want to remove in terms of the Alliance piece is durable medical equipment. And you might be like, what is durable medical equipment? Durable medical equipment is things like wheelchairs, crutches, your diabetes testing machine and the strips. That is all considered durable medical equipment, to which I am like, if a person who has diabetes is not able to check their insulin levels, then they will end up in the emergency room and it will cost us more on the back end. So why don't we just let them hold on? So that is the types of things that we're also sort of thinking about as well. Now, in terms of what's happening on the federal piece, I will say, we are not the only jurisdiction who's dealing with this. California, who also has a program similar to the Alliance, has already started to phase and shut theirs down. Again, the penalty on the other side, we could debate it all day long, but it is significant. And we know that this administration is petty. That would only be the first step if we were to say, oh no, we're gonna keep going. You can't tell us what to do. So that's just something we have to sort of keep in mind. Okay, so I want to switch from, I'm so sorry.
I'm sorry.
No.
I'm still stuck on a couple of points. Now, you indicated October 1, 2027.
Yes.
Adults will no longer be covered by the Alliance. Now, we were talking about immigrants at one point, and then you switched to this point. I want to know if this is considered to be all adults completely no longer covered by Alliance, or how is that broken down?
So Alliance is different than Medicaid.
I understand.
Right, so if you are uneligible for Medicaid, if you are uneligible to receive any of the tax credits and subsidies and whatnot that is offered on the exchange because of a variety of things, then yes. Now, the question you might have in the next part is what happens next? Because these folks are still gonna seek healthcare.
That's exactly what my next question is.
Yes, so the Alliance program is actually, it's old, but it's kind of new.
Right.
We didn't have Alliance pre 2011. And so one of the things that we have quietly, well, we're live streaming on YouTube, so not quietly that much anymore, is having conversations around how do we ensure that our providers are able to stay whole, because people are still gonna show up for care. And also our hospitals have a responsibility not to turn anyone away. And so I'm not gonna put out there what we're thinking, but we're thinking about it.
Okay.
And we know that there's some providers in particular, we've been having conversations for whom the majority of their patient base are Alliance members. What happens to those folks? Or the majority of their patient base are Medicaid recipients. What happens to those individuals, right? I was just, right before coming here, I was at Howard University Hospital, which would fit into that realm of the vast majority of the patients who are treated there are Medicaid recipients or Alliance recipients, right? So the changes that we are making or the changes that are being proposed on the federal side would hit them specifically. And I want to make sure that we're not losing any of our hospitals in this process or our primary care, pharmacies.
Councilmember, I was thinking about the patient care of all of those other groups. So at the end of the day, if there's no plan by 2027 to ensure that citizens are still receiving coverage out of our tax dollar base, then I have an issue with her proposal to stop it in 2027.
But for most of the people on Alliance, they are not US citizens.
Yeah, there's a portion of them that are citizens, and that's what I'm talking about. That's what I meant. There's a portion of people on the Alliance program that are citizens. And that's all I'm saying, that, fair enough, if you end it, that's why I said, what are the target adults?
Yeah.
What are those groups? Because there are some, from what I remember, unless something has changed, there are some adults who are citizens of the District of Columbia or, citizens of the US that live here. Not only just natives, but they are on the Alliance program. So that's why, I would like a little bit more information. I'll get with you later.
Okay, yes, sir. And you'll be the last one on this because I've got some DPR stuff that I want to talk about.
My question is in as much as this was put into place before, it seems all of the federal pushback on does that mean that we should expect this to be in place regardless of what happens at the federal level, or is there a chance that something could happen?
There's a chance that this timeline would have to be expedited.
So it's not a situation in which any pieces of this would be gotten rid of, it's just, it might end up needing to be sooner rather than later.
Correct. Okay, I want to go on to the next topic. So capital investments. I didn't do this in Work Pack because they gotta see them. But nonetheless, let's talk about it. Okay, so DCPS. This is just a summary of the capital investments that were included for DCPS for Ward 8. So green, 25 million. I believe that's already under construction. Hart Middle School is slated to start their modernization in FY26, which is good, and it's fully funded. King Elementary also slated for its modernization between 26 and 27. Ketchum has funding as well. I don't believe that construction will start until FY27. Simon Elementary, Hindley Elementary, and Excel Academy would be sort of rounding out the last pieces there. We go to the next slide. Okay, so for our library investments, Parklands Turner, which I'm sure there have been lots of community conversations and things like that about, that is moving forward. Then there are various investments that are occurring from DENPED, which is the Deputy Mayor for Planning and Economic Development. So they're going to be doing some more infrastructure work on the St. Elizabeth's campus, and in some ways preparing the ground for some new projects that are supposed to be coming online there. There is, this is housing, so funding for Berry Farm, Parkchester, and Wade Road. Those projects are included in the capital plan. Go to the next slide. For Parks and Rec, the funding for Anacostia pool replacement was included. Douglas Recreation Center, They're gonna do a renovation to the Naylor Road shelter. So this is actually starting a process because if you guys remember, we did the family shelters first, and now they're going back to do all of the individual adult, men's and women's. And then there are lots of different investments in terms of Department of Transportation. Some of this is like federal money, and then some of it is local investment as well. So South Capitol Street, the 11th Street Bridge Park, the bridge, that also needs to be redone. And I'm gonna get you, Sheila, let me just, is this the last Capitol one? Okay, yes.
So, hello, Councilmember Henderson, thank you for being here, thank you for doing this. If we can go back one slide. So looking at, I'm sorry, you were in the right side. So looking at, our DPR facilities, what I did see in the budget was Commerce Heights Rec Center, Fort Rebel, and the Senior Wellness Center. And I don't know if that means that funding is there and they didn't need anyone, everything is okay, but those are 3 capital projects that are also important to Ward 8, and they weren't listed in the mayor's budget. So I wanted to flag that if you could find out, okay, what's going on.
We will go back and check. I had my staff go through and try to pull every project. It is possible we might have missed one, but can you say the 3 again, just so that they know?
So Commerce Heights Rec Center, Fort Rebel Rec Center, and then the Senior Wellness Center down by Ketchum.
We will check on those. Yes, sir.
All right, I have a comment and a question. So,
Okay.
so the concern here is, while I appreciate all the schools being modernized, it tends to be in Ward 8 and Ward 7, our schools rather have a nice Band-Aid rather than being rebuilt like some of the other schools in other parts of the country. And for $80 million, you can literally rebuild a brand new school for kids in Ward 8. The other concern is when and I know we're gonna people are trying to be careful, but saying this, when Fenty and Gray had a conversation about the 11th Street Bridge Park, it was committed to the community and the residents, particularly as a former ANC commissioner, that there will be no district money at all with the creation and the support of the 11th Street Bridge Park. And particularly in this crisis of having to close a $104 million possibly gap in Congress, that $10 million, if it's not federal money, is a lot of money that can keep savings on healthcare, that can help rebuild a rec center. And as a person who has a restaurant in Anacostia, I know the importance of having that bridge. But you now have the Navy Yard Main Street in the bid, fighting for a project that they were opposed to when it came about. And it's unfair that now Ward 6 is trying to take credit for a project that Scott and Christina and Ward 8 fought for so long, that now the council is thinking about giving the bid in Ward 6 part ownership of this project. And so hopefully as you all look at what this looks like from a budget standpoint, this is cute on paper, but Ketchum has been underdeveloped for the last 10 years, getting money every now and then. We spent $40 million remodernizing Stanton, and they have a DGS is there doing a new HVAC system every other year. So hopefully we can figure out how we do brand new buildings in Ward 8 rather than fix-ups.
No, that's good feedback. I know from the 11th Street Bridge project that they had some matching dollar commitments. So it was sort of like you got federal funding, not federal, sorry, for some private investments. They also needed to have some city investments as well. I didn't bring the budget book with me, so I don't necessarily know the breakdown in terms of investment pieces, but I think you know this, like the important, well, in terms of the capital improvement plan or the CIP altogether, we have caps and limits on how much we can spend in capital each year due to our debt service cap. If we go back, and you rightly pointed out, go back to the DCPS one, there were some elementary schools when Fenty was mayor that it was what they refer to as like a phase 1. So it was like you got paint, you might have got a new entrance and a sign, and maybe some changes to the classroom spaces, but they didn't really do sort of the deep dive, if you will. When we went back with PACE, which happened when I was a staffer on the council, the goal was to get away from phased modernizations and to ensure that we're doing complete modernizations, which was so important for, at least in this community, for us to get back the Magogny building, which was old Eagle Academy. Because in order for DCPS to truly execute on the full modernizations, we needed swing space to be able to do that, and now we have that option here in the community, so folks don't have to go far in order to do that. Now, the fact that at least here in Ward 8, right, you've got multiple projects that are happening in FY26. Some of them had already started, and so we'll be completing in that time. Right now, in terms of construction, now this could be from the larger questions, et cetera, but I think this is the most modernizations that's happening in any given ward is all at the same time as happening in Ward 8.
And then a follow-up for the 11th Street Bridge. For the 11th Street Bridge, it says 19 million. Is that separate from the bridge part? Because I know that we just rebuilt the bridge.
Yes, that's what I understood.
Yeah, it is a separate line item. And actually, I think the 11th Street Bridge money is not, it is not local.
Okay.
I don't believe the 11th Street Bridge, for the actual bridge, that is not local. That is federal. Yes.
What investments are we making to attract grocery stores?
Well, that's an excellent question. So you know that we have the grocery store fund, which has been a challenge because over the years, council members have amended it to add other areas of the city to allow for them to be able to get some of those tax investment pieces. It's not in the ward directly, but in the budget, there's some contemplation around East Capitol Street and a plot of land that we had been trying to use for a grocery store that needs to go through the eminent domain process in order to be able to do that. That doesn't accomplish 100% of what you're talking about. It doesn't. And so that is actually part of the questions we have for DMPED, whose hearing is coming up, around, I see a shift in terms of, there was one point where we were talking about grocery stores a lot, and now it does not come up as often as it used to. I will tell you, for the health committee, we're trying to augment. I'm not on the committee on, business and economic development, which is where this is. But we funded a pilot through DC Health in partnership with a company that I can't name yet, which essentially the district is covering the grocery delivery fees for a year for residents in wards 5, 7, and 8, a certain number of them, to be able to, in the interim, help to facilitate folks being able, especially folks who are homebound, facilitate them being able to get groceries delivered to them. Hold on.
Okay, yes, thank you.
Okay, because you're the chair, the co-host to the event, so I'll let you.
This is very serious, grocery stores. We have a couple of stores, and one that's on the verge of probably closing, which is like legal. Their stock is inventory down, the theft, pilgrimage, stealing out of the stores. Has the city council ever considering grocery stores east of the river as an essential service and give them protection like they would something else? Because
What do you mean by protection?
Well, because it's a need, because people need food. And people don't need fast food on the corner, they need fresh food. But because of the problems that these stores have, both Safeway and Giant, the pilgrimage is just ridiculous. They steal out the stores all the time. And they bring these stores to the point where they don't know whether they can stay in business. I'm telling you, the Lidl is is on a lifeline. And I'm thinking that they might need to make it. But to look at it in terms of an essential, a hospital is essential service east of the river. A grocery store for us, since we only have 3, is an essential service to what we need for seniors who are trying to get food. There needs to be something that says, we will provide you with the protection, the police, whatever they need to do, special whatever have you, to keep these services up and running. Because if the Safeway goes, Giant was threatening to close next week.
Yeah, so
We need to do something that really speaks to the breadth of what's happening east of the river as it relates to supermarkets.
yes. So when I first was elected, I had a bill proposal that wouldn't have been put a bunch of police officers there, but it essentially would have said, let's establish an agreement where we are saying, as the district, if you come to X location, we will cover up to X percentage of your loss in terms of kind of a risk management insurance policy plan. I had conversations, sort of pitched this to developers who do grocery stores. And they were like, I don't know if you want to do that. Because number one, it would require a grocery store to sort of open up their books to the government in a way that they don't often do. But 2, you don't want to essentially put out there a perverse incentive, if you will.
Right.
That is like, no, come on, because the district's just gonna cover it. So do what you're gonna do, right? That could become very costly. The other thing in conversations with some of the developers who do the grocery stores is that in other parts of DC, and actually in most urban areas, it is never just a grocery store, right? They very rarely do the single site in the same way that you see for Safeway and others, right? It's usually a grocery store and then something above it. Or to sort of increase the density, because that's one of the larger issues that we have in terms of, and you guys know this from the census, right? We saw a lot of population decreases in Ward 7 and 8. And so from a density perspective, we have to boost the numbers in some way so that but a grocery store, which is a business also, has an insurance that I've got a population base that can sustain me beyond 2 weeks of the month in terms of their capture. This is something that I'm super interested in trying to figure out. Like I read like The Secret Life of Grocery Stores. There's a whole book that's on this, trying to basically understand the financial mechanics and why they choose where they go or choose where they don't go. I do feel like for some of it, it is the district's fault. That we are not promoting certain areas of the city as a viable option where people live and have income, because food is food, right? I may not have the income to fly to Paris and do all these other things 5 or 6 times a year, but I gotta buy milk and I gotta buy cereal and do all of these different things. And so this is one of those areas that I feel like we still have to continue to sort of double down on. Obviously, when I go to other parts of the city, I'm like, did y'all need another grocery store across the street from each other? And I would love to know what the financials are that you think that this is a viable option for you. But somebody did an analysis and was like, yeah, we could be across the street from each other, which is not, it doesn't make sense to me. The other thing that we have also been, because this has been a case in Ward 5, I've been in this, I don't call it a battle, but an ongoing conversation with the deputy mayor. I don't understand how there's not a grocery store in Fort Lincoln. It doesn't make sense to me. All those townhomes, all that senior housing, all those apartments that are put in there. And they're like, well, there's not a grocery store that wants to compete with Costco. Who is competing with Costco? If it is you, single adult, what you buying at Costco? Toilet paper, paper towels, laundry detergent, right? You're not going to Costco for milk. You're not going to Costco for eggs, because who's buying a 5-gallon thing of milk, for any given day? So this is something where I don't think the investments are very well. And we're debating this on the council, right? Because there are colleagues who want to invest. So we have a grocery store downtown. And I'm like, how are you going to put a grocery store downtown before you put another one in Seaport?
But with all due respect,
We got-
we invested in a white man called Phil Sandoval built out an entire grocery store for him in the Bellevue community. And 6 months later, he decided to walk away with millions of dollars to the Midwest. And this council and this government did nothing. We created, Councilmember Trayon White created an entire grocery tax bill to allow for folks to be able to get a tax subsidy for opening up grocery stores, and the pilot failed. We reached out to every at-large council member office, and every at-large council member office that we go to my ward council member about this. We reached out to every member on the committee on the health, said, hey, there's a food desert in Bellevue that is being overthrown by a guy who misused and committed fraud. We went to the Attorney General, and no one did nothing. It's an entire built-out grocery store in Bellevue.
I wouldn't say that no one's doing anything, because that situation is a bit complicated.
I have a store in there.
I know, you know, well, yeah, you know, but I mean, in terms of, right, because I've got other organizations who are like, then give it to us and let us do it. We've got the food. Transfer it. And it's caught up in the legal over a utility bill?
Utility bill, but the city gave out millions of dollars for everything. Cutting a check to Pepco and DC Water to allow for somebody like Good Food Market or whatever it is to go in there, it's nothing. We make excuses when it comes down to Black and brown communities about not having money, but then somehow we find money to keep building things and giving away tax credit. We need money, guess what? We like to drink. Let's do a permanent increase in the liquor tax. Ain't nobody gonna complain about that. And then you have a lot of money to be able to help do these things. We're not being creative, or we're not thinking progressively about how to save Black and brown communities. We're crying broke, and guess what? We have a $100 million deficit, and guess what? If we figure out that, you know what, there's all these parking tickets, let's set aside some amount of this money in parking tickets to benefit the ward for the people who are being victimized at. That's the thing. We have all these things that we're giving away tax breaks. We're asking the council for $54 million to buy property off the East Capitol because Walmart walked away, because Giant walked away.
That's right.
And we're hoping that another person want to come and buy the property. We have 1, 2, 3, 4 Good Hope Road, which is supposed to be a grocery store, retail, senior housing, and property, and the developer can't build it because Bank of America, who's building the property, want more money from the city.
So good for them. Brenda?
Yes, but I wanted to add to the point about the grocery store commission. And I think the counterpoint to that is we can work with community members to make the grocery store a bit safer. I live in Ward 6, and our Safeway is honestly becoming militarized. We have cops that sit outside the Safeway day in, day out. We have this gigantic pole that yells at you, no loitering, in front of the Safeway. They pulled up all of the seating area to minimize loitering. They have security guards, and it's to combat that. But where's the conversation with the neighborhood that says, hey, how can we make this Safeway safer? What can we do to meet your needs? So, I mean, people are stealing mainly because they're hungry, I would guess, not just because they want to steal, but they're hungry. Like, why else would you be stealing? Right, so how can we talk with neighbors that say, listen, look at what's happening. We've had shootings in front of our Safeway. I mean, it is wild. This is what neighbors talk about on Saturday morning as you're walking to the market. Oh, did you hear about the shooting? Yes, it's a problem, but folks want to be safe. Black folks want to be safe in our neighborhoods, but we're not having conversations about what can we do to mitigate the risks that you are facing as an individual that's leading to some of these crimes, so that we all can benefit from the common good of having a grocery store. So in future conversations, I would love to hear more about how are we listening to individuals' needs versus let's just bring in more cops who are going to sit there and make everybody feel just like icky and see, so you're just trying to go buy some eggs. Like, you don't need MPD sitting there literally policing as we're going about our daily needs.
I just wanted to say, something.
I was trying to be really point blank, just because Philly did have her hand up like this for the longest. You didn't see it in the back.
No, he's all.
Okay, go ahead.
Guys, okay, what time is it? We know we got a little bit of time. Let's just get through it. Because I want to talk about TANF. I'm on the Human Service Committee. I don't chair that committee, but I feel like this is part of the budget that's important, that has been talked about perhaps the least, I feel like, in the public realm.
I just have one thought.
Yeah.
I know you heard this from Jerry and from Chris, but maybe not now,
Yeah.
very active. What can we do to make that happen? They have funding yet.
They have a funding gap. They've lost some funding on the federal side. We're having conversations with them and hopefully we can address that.
Okay, and then secondly, for all of these capital investments, I know this is FY 26, but if you can also make sure you're looking at the FY 25 supplemental, because I went through and there are some cuts to capital funding. So just wanted to flag that if you can look at those as well, because some of those projects lost funding in FY 25 supplemental.
Yeah, we've been having some of those conversations. I went to the DGS hearing today to ask some of those to Delano Hunter around like, what does it look like when you cut in the middle of a project otherwise? Okay.
Okay, and so.
Oh, wait.
I asked what I can do, and, then maybe Stu can go out.
No, I
But
just,
anywho, I just wanted to ask, could you consider taking this back to the, council as a whole? Whether or not you guys could help Giant, for example, come up with these new systems. They're very expensive to install, but a person could use their receipt with a barcode to exit. That has deterred crime at some other stores, is my understanding.
Yes.
I'm not sure as to how much the research would have to be done to see whether or not that's a viable investment, but at least consider some other option so we don't lose our Giant. I'm with him on that.
Yes, so that has been installed in some other locations around the city already. I don't necessarily know from Giant as a corporate entity or Safeway as a corporate entity in terms of their plans of rolling it out across the full
I
district.
know ESO was going to do it, but I'm not sure in terms of Giant losing so much money due to that, whether or not they can even focus on that as a possibility. But if you all could discuss it potentially as helping them with that, because of the security that was discussed earlier, that would be helpful.
I'm so sorry, Councilmember. So I just got this just now. And so last week, the deputy mayor, I sent the council a letter that they were giving Giant on Alabama Avenue $1 million in rental offset, $800,000 for security improvements, $720,000 to buy security patrol cars, and they also exempt them from the CBE requirement for them hiring district-based residents. And so my understanding is, or my question to you is, we're giving Giant almost $2 million that's outside of the grocery store, which we all need, that is not hiring no water-based companies who have security companies, hiring no water-based companies that can provide the amenities that they need, because we believe that a corporation like Giant can't go out and find district-based businesses to provide the services that if it was me, I would be forced to have the 35% CBE.
That sounds good.
And this letter just came out on May 19th.
And it sounded like an investment in policing.
Yes.
Security.
Yes,
And rent payments.
Okay, policing, security, that.
they've couched it as, the deputy mayor referred to it as an incentive for retention, as in this was the negotiation or conversation that they had to keep the store.
But these are grocery stores that are, for example, I have a restaurant across street from Lighting. Skyline Town Center has 7 security officers, 3 at any given time, rotating the entire community. Lidl has a security officer sitting at the front door the entire time. Lidl. And so if Lidl was that serious about investing in their protection, they wouldn't have somebody, no offense to my seniors and my elders in here, someone who's unable to walk around the entire store, to be able to do all of these things. And what they do is they say, oh, people are stealing things, they go to the city and hold the city hostage for more money, and then we pay, because we know we can't have a grocery store leave a certain community.
No, I mean, you made.
While still building grocery stores in low-income neighborhoods like they just did, just in Ward 5. I'm sorry.
No, your frustration is justified. Your frustration is justified. This hasn't been an issue that has been on the top of the list. And in the conversations when I try to talk about food with this new deputy mayor or the CA or otherwise, they are not thinking about it from a grocery store perspective. They're thinking about it from, we talk about restaurants, we talk about bars, we talk about all of these other different pieces. I'm trying on the health side where I can sort of like insert in pieces because I'm not on that committee that works on some of these economic development deals. And frankly, in sort of the hierarchy of our government, right, it is the priority, or not the priority, it is the prerogative of the mayor to initiate economic development deals. The council can, right? So when we're having these conversations around attracting certain grocery store businesses to certain parts of the city, it's not like I could call up Trader Joe's and be like, hey, I've got this perfect parcel of land and I can offer you a 10-year tax abatement and da-da-da-da and da-da-da-da and da-da-da-da. I don't have the authority to do that as a CM.
Well, it comes to you all because after a certain amount of money that the mayor proposes, you all vote on those bills. And so.
Yeah, but you okay?
You okay?
I'm sorry, I was focused and all of a sudden there was something in my ear, I apologize.
Okay. Okay, I want to talk about TANF really quickly. Okay, so this is important because, again, this is in the Human Services Committee. All right, so there are two different types of TANF programs that we operate in the district. We have TANF Federal. It's all federal money. And then we have this thing called Local, which is the TANF local program that we have here in the district, okay? So in FY19, and again, if you just look at your slides, it'll be much clearer on there. The TANF program on the federal side is a block grant. The block grant hasn't changed since Bill Clinton was president. Okay, so for the youngins, look that up. 92. Okay, so in FY19, we were spending about 8.4 million plus contingency, so I don't know, round up $20-ish million from our federal pot. On our local pot, we were paying about $33 million. Now, who qualifies for the local? The local program is designed for someone who has exceeded their limits on the federal program. Federal TANF has a maximum limit of 5 years. So in terms of program design, if somebody has exceeded their limit of TANF on the federal side, then you can switch to the local side. The local program has no limits in terms of time. That is important, okay? The local program also is the only program that has the annual cost of living adjustment. That is part of it, all right? So in FY29, in total, we were spending about $84 million for both the local and the federal program for TANF, and we had about an average caseload of about 12,744 people. All right. In FY24, we were spending about $115 million on TANF, and the caseload didn't really grow that much. It's 13,694. Right? So you could ask yourself the question of what changed. And some of that, and also to be clear, right, we are spending way more in terms of our local expenditure. Our local expenditure went from 33 million to 86.6 million. So that's the number of people for whom you, let's say, graduated from the federal program and now you're on the local program and you've been on for that long. All right, but we haven't really added new cases because it's sort of an average, if you will. So the mayor's proposing some changes to essentially bring the local number back down. Not all the way to 33, but partly. So let's talk about a little bit of that. So that's, just so you know, the cost has increased about 167%, which is a very big number.
So are those families for the same number of people?
Yeah, so this is families,
Okay.
right? So to, yeah.
So
That-
family of four would count as the same as a family of two tonight?
Yeah, so this is a single, like a,
Same household?
yes. The number is a single household, not the number of individuals totally impacted. Okay, keep going, just load them all. All right, so here are some of the things that she's proposing in the budget. So, those are the cost drivers. Oh, no, back up. Oh, hold on. I know, she went too fast, hold on. We back it up.
With speed reading.
Okay, so here are some of the changes. Oh, it's okay.
I lost mine.
Advance through.
For some reason, I was like,
Oh, wait, go back, go to the next slide. So I talked about some of the pieces in terms of cost drivers. So the first one, the biggest cost driver is the no time limit piece. We asked, what's the longest that somebody's been on the TANF local program, and it's been a minute. Okay, so technically in the TANF program world, you are supposed to meet certain requirements in order to be able to continue to qualify for it. And some of it is around, are you in an education job training program, or do you have a job, right? Those are the pieces that need to be there. Okay, so in the local program, if you do not meet the broad participation requirements, you're supposed to have a quote unquote sanction of 6%. So you would lose 6% of your benefits if you don't do what you're supposed to do in that piece. 6% is such a low amount. Nobody really cares. So we really haven't been doing sort of enforcement. Another cost driver is that a number of years ago, this was pre-council or when I was on the council, there were some changes that were made in terms of what accountable activity was. Different from the federal. So for federal, it's straightforward. Job training program, are you searching? For our local program, we have broader things, like if you get a library card, that counts. If you go to a doctor's appointment, that counts. If you go to a PTO meeting, that counts. So we have a very broad, now, again, there were good intentions behind all of these things when that happened. And then of course, then the annual COLA, that was, the annual COLA started in it was pre-me. Yeah, it was pre-me. It wasn't funded for until started in FY25 where we made them put it into the budget. Okay, anyway, keep going. All right, so here's some of the proposed changes. So the first change that the mayor is proposing is no additional COLA beyond this year. So basically your benefits will hold constant starting in FY25. The next big one is that they will start to phase out adults who have been receiving benefits for longer than 60 months, starting in FY27. And so that will go all the way down. Now, to the question that someone said, whether or not this is retro, yes. So it doesn't, your 5-year count does not start on October 1. Your 5-year count is looking at across the lifetime of you being on the program. So there are some individuals who have been receiving TANF local for say 15 years at this time. They would be the first folks to sort of step down. And it would be a step down over time, right? It's not an automatic, you're cut off, but it would be a step down over time. Is there another piece of that? So that is sort of the biggest pieces there, which again, I don't feel like people have talked about enough. And I also recognize that this, in my opinion, is kind of compounded because on the federal side, which is not us, the Congress is contemplating changes to SNAP. Now, is it entirely possible for somebody to be receiving both TANF and SNAP benefits, and then the changes on SNAP would it would actually require the district to pay more. So for instance, right now for SNAP, we don't pay anything locally. Your SNAP benefit is completely covered by the feds. The initial bill said that would change that so that states and localities would have to pay at least 5% of benefits that are going out the door. But then there's this extra piece that is a penalty. So there's this thing called a SNAP error rate. So you get an error rate based on whether or not we are giving money or we are giving SNAP benefits to people who are technically ineligible, or we're giving them too much than what they're supposed to have. Based on where your SNAP error rate is, they up the amount of money that you have to contribute on SNAP benefits. where the district's SNAP error rate is with the Department of Human Services right now, our penalty would be an additional $79 million that the district would have to pay into SNAP. And then they also are introducing what they call community engagement, which is essentially work requirements that would essentially match the TANF piece of job training, or looking. So not the additional things that we allow and qualify for. Okay, I want to do a time check. What time do they get this on?
So,
No, what time do they get this on? Okay, all right, so we're gonna keep that in mind. It's 7:52. We got 8 minutes. All right, I saw her first.
I'm gonna keep it really quick. I think it's worth noting that TANF is temporary assistance for needy families who are the farthest at the margin in terms of poverty and need. You already mentioned the compounding thing here with SNAP facing federal cuts. You've broken down very clearly the cuts, and these are essentially cuts to TANF. If we are not doing a cost of living adjustment over years, like money being lost, people being kicked off, are you as chair of the health committee working to reverse any of these essential cuts? And as the sponsor of Give SNAP a Raise, working to find local money to offset the federal cuts we're seeing for SNAP?
Yes, okay, so I will speak more to the SNAP piece. So I don't chair the TANF program. I am just a member of that committee in terms of some of these things. Now, I'll be honest with you. I feel like when I had the first briefing to fully understand what was happening in our local program, I said to the DHS folks, I was like, oh, we're running a universal basic income program and we're calling it TANF, which is fine, but like, let's be honest about what we're doing. And if that is a decision that we want to do going forward, then we need to make sure we're putting some guardrails around this to be able to ensure that it's sustainable. Because right now, it's not sustainable. And I think some policy choices were made when money was flowing and we had surpluses every year. And I think now we have to really think about, was that the best use? But also too, right? I think for some people, they don't have a desire to be on all of these various programs, but because of you get benefits cliffs, if you're, no? I don't know. So we're looking at it, right? Because I can't make any commitments on this. What I can tell you is in the health committee budget, where you already saw the cuts I'm facing, I don't have enough money to send to Councilmember Fruman's committee to reverse all of this in health.
I will say, I really hope that y'all will speak with each other about progressively raising revenue across the board.
Okay, all right, how many minutes? All right, I did see Kalik. Congratulations on graduation and all that.
But the conditions that create poverty, like generational inequity in the schools and for housing and like job and stuff like that, those things aren't temporary. So with that, how can we justify cutting support to families who are still trapped in those same systems?
Yeah.
And then my point is, it is temporary. However, at the end of the day, the realities that force these families to like rely on it are deeply rooted, mainly in generational instability. And so reducing or phasing out support after those 60 months assumes that everybody would possibly have access to this robust, I don't know, the same access opportunity or whatever. But in places like over here in Ward 8, we're still battling these systematic barriers that doesn't disappear, especially for us young people. It's not just a simple check that we have, it's stability like groceries, school clothes, and like a peace of mind. Cutting that without addressing the root, it's like it's short-sighted.
Yes. Frankly, all of the various pieces that either being proposed on the federal side or that the mayor is proposing here actually requires our system to work better. That's why I went to the hearings around like DOES and otherwise. Because if we're gonna start introducing all these work requirements and stuff, the Department of Employment Services has to work better than it is.
Oh, yeah.
They're not doing what they're supposed to. Right? Now, again, I'm not on that committee. And I don't wanna use that as an excuse every now and then, but this one, for some of y'all who are like down there, it's just like, right, I can come and do the hearing, I can ask the questions for maybe the 7 minutes that Councilmember Bonds gives me every now and again, but like the stuff of work that needs to be happening at Department of Employment Services is systematic in terms of doing work. And so, and thinking about some of the other pieces too, right? So we have a proposal, we've been having conversations with OSSI. In the health space, I need nurses, I need phlebotomists, I need all of all the various different things. And so I said, all right, can we use the SYEP program a little bit better than what y'all doing? Because right now we paying people to sit in a room and I don't, or that, whatever. I said, okay, we lowered the age for certified nurse assistants to 16. A certified nurse assistant, you work in a facility, right? A nursing home and that kind of thing, under supervision. To be clear, you're 16, you're not doing something else, whatever. But it's good money. They're making on average like $21 an hour, if not more. Okay, so if you could get certified at 16, then why don't I pay you during SYP to go get trained? So we're trying to do that with Advanced Technical Center. So like by the time you finish SYP summer, you take the test, you get certified, and through the school year, go get you a job at one of these nursing homes. And let this be your career ladder in terms of that. And that's why I'm like sort of thinking of like, okay, if I already got money set aside for something, then let me pay some of these young people to start getting trained so that when they get on the other side, they can take some of these jobs and these positions. But all of this requires our system to work better because temporary was what it was meant for. It wasn't meant for somebody to be having to use this as forever. And unfortunately, the way this whole system is set up, we have not allowed for that to come apart. Okay. 2 minutes. All right. Just.
You can take your preference.
Of the 13,000 that we currently deal with, how many will this reduction affect? I just want to know.
Oh, I wrote that down. Oh, but I don't remember. I have that number though. Yeah, go ahead.
Okay, I have 2 questions real quick.
It
seems as though, what has happened in the political climate that we in, that the council has made a decision that they should have made 10 years ago to phase down this program. It's like, now that we're in the face of the situation, now we're gonna do what we should have done 10 years ago, or 15 years ago, with the word temporary. So I'll leave that there. But my other one is to you, and I know you said you was up there today. How university is my alma mater?
It's you.
You know. Listen, and as you know, they have been told that their advances is not going to be their sponsor anymore. And I noticed that you were up there. I don't know if that was part of the reason why you're up there. But what are we going to do to ensure a smooth transition? Because that hospital is critical. It is absolutely critical to the health of so many people who live in that part of the city. And is the city going to look at trying to get involved with making sure that there's a continuity of care when this contract is up?
Yes, I mean, we've been having conversations with the university. They don't necessarily want to be in the business of running a hospital anymore, but that hospital location is critical. So we got to find the right partner. And I tell you one thing, the district, we can't run a hospital. Yeah, we're not doing it. So how can we partner and find somebody? Okay, Sheila, answer to your question. 6,500 are already at the 5-year mark, so 50% of the people who are currently receiving TANF are already at the 5-year mark. So I want to thank everybody for being here on this evening. There was one other thing I wanted to say. It has left my mind on that front. What I will say is that the budget process is not over. And this is important. The budget process is not over. We still are having hearings that are going on. The council's first votes for markup will happen the last week of June. But that is also not the end point as well, because on June 30th, the district will receive another revenue estimate. And if that revenue estimate is lower than the revenue estimate that we received in February, we will have to make those additional cuts through this budget process.
Is RFK still in the budget?
What's that?
Is RFK still gonna be in the family budget?
I haven't voted yet, so I don't know. So on that front. And yeah, if you have additional questions, let me know. What I will say is that I think this budget is super critical and important for people to engage on and stay informed through the whole process. Because what happens on June 30th, there won't be another budget hearing after we get the revenue estimates. So you have to stay alert, and I'll do my best to communicate to folks around, okay, how much money are we talking about and what are the changes gonna be made? Because when you get a revenue estimate and if there might be decreases, it doesn't come back and say, okay, Committee on Health, you have to lower the budget by 5%. So there has to be a conversation amongst council members in the community around where do those dollars come from? Because it won't be evenly spread across the whole board, if that makes sense.
Yes.
All right,
And
so
the first vote on the budget is
the first vote on the budget is in July.
14.
Uh-huh.
Second vote is July
28th, yes, ma'am. I wasn't trying to sidestep your question on RFK, but I am sidestepping your question on RFK because I don't know what's going to happen on RFK.
No, you're good, I just hope that there are businesses that are non-franchise owned by district residents that can have food businesses inside the stadium. As a good CBA funding.
Yeah.
And then as well as residents owning part of the parking lot program. So between citizens starting parking lot companies to own part of the $8,000 parking spots. And then turning the word, when we get talking about the jobs, about new jobs, to all jobs being like district residents. So that way if I have employees living in Maryland, then they're eligible to work on this project because they're not a district resident. And so community impact looks different, but as a restaurateur, having a spot inside RFK develops longevity than the 2 years it takes to build the spot.
I hear you.
And on the RFK, when is your intended, your to back?
Mid-July.
You think before? Before the first vote, maybe?
Maybe,
Okay.
but mid-July. All right, thank you all so much for coming and being a part. Thank you again to the Anacostia Coordinating Council for partnering with us. Have a lovely evening, everyone, and please stay engaged.
Yeah.